Good afternoon, friends. David Wright here, and I am your host of the Disruptive Innovators Champions of Digital Business podcast. And today I am lucky enough to be joined by Mr. David Sylvan. David, it's a pleasure to have you on.
Thanks for having me. I'm excited to have this chat.
Yeah, absolutely. For those of our guests, David, who might not be familiar with your work or where you are today, could you just tell everyone a little bit about your current role?
Yeah, absolutely. And again, thank you for having me. I am in the privileged position of playing the role of Chief Strategy and Innovation Officer for a healthcare system in Northeast Ohio known as University Hospitals. I also hold the role of President of Ventures, which is the embedded corporate venture capital platform. And that is a melding of our innovation focus and ethos together then with the opportunity to impact, system strategy. We're a 23 hospital system, about a $6 billion top line academic medical center, but also offer clinical services to patients in rural and community settings. So all the way from community and rural to quaternary tertiary. We have affiliations with various universities, Case Western Reserve University and others, and excited to be here. It's a
Yeah,
fascinating time in healthcare.
I agree. And I know this has been a little time in the making, so I'm excited to have you on. David, we like to just start with one piece of actionable advice you might look to leave everyone with today, if nothing else.
Boy, there are probably a number, David, but I think the one that resonates for me right now, because I'm truly forcing myself to adopt the discipline, and that is to listen more. I find that we are the tumultuous time that we find ourselves in healthcare implies that a lot of people with a lot of great ideas and a lot of opinions want those to be heard at times at the expense of others. And I think this ability to put yourself in a position where you can listen and absorb, speak less, but be impactful when you do, in fact, speak. I think that would be, for me, an actionable piece of advice.
Yeah, it's a great one. This podcast was an exercise in really trying to get better at active listening, because the podcasts that I admire the most, or the interviews that I admire most, are the ones that are the most organic, right? And not based on just question, answer, question, answer. But in order to do that and be dynamic, you really have to focus on listening and not like, okay, what's the next question I'm going to ask, right? So great advice to start us out here. And David, I know we talked a little bit about your background and all that. We were talking about living in New York and that sort of thing, but interested to share with folks, and we like to do that on the episodes, just kind of how you started out and how you got to the point that you're at in your career today.
Yeah, it's not been a straight line, David. I started out born and raised in South Africa, an accounting and business law focus from an academic perspective. Candidly thought I would stay in public accounting until I began to do exactly that and realized how much I detested it. With all due respect and love to my friends who are CPAs. Moved to the States in the late 80s, early 90s, lived in the city as we discussed earlier, and found myself attracted to the sports marketing industry. And I joined a firm by the name of IMG, National Management Group. They had a couple of offices in Manhattan, but I moved to headquarters in a place I'd never candidly heard of, Cleveland, Ohio. Truly thinking I'd be here for a couple of months, couple of 6 months, and north of 30 years ago now. Did that for a while. Learned the underbelly of the business of sports from a client representation and an event a promotion perspective. Traveled the world for that, and did some very interesting M&A types of activities, and then transitioned into investment banking. So I went to a material pivot from what I had been doing, and began focusing on the so-called financial synthetics world, derivatives. These are financial instruments that uh, transfer risk from an entity not wanting it to an entity that's willing to house or trade or monetize that risk. Did that for about 16, 17 years. We focused not only on interest rates, we focused on currencies and commodities and metals, etc. And I also ran an investment banking group known as public finance. That would be a focus on an area that would underwrite tax-exempt paper for tax-exempt borrowers, like hospitals, cities, communities, schools, etc. So an interesting combination of activities that had me back in New York extensively, as well as across the country. We have offices across the country. So traveled extensively for 17 years. And then, having lived through a couple of financial crises, decided it was time to exit stage left, which I did. My wife sent me to cooking school. She needed to, candidly, because I would burn water when I tried to boil it. I went to started yoga, which was tremendously valuable to me, but began to feel a little bit disengaged from professional life. Perhaps naively, or perhaps from the perspective of ego, and stood up my own small consulting practice. Began to teach on an adjunct basis at Weatherhead School of Management, which is the business school for Case Western Reserve. Still do that. And one client that came along was this hospital system looking to stand up an innovation platform. I knew nothing about healthcare. I knew even less about the formalities and the mechanisms of innovation. What I did know was that I was a failed angel investor when it came to medtech, and I just didn't understand why, David. A great technology, an apparently robust unmet need, a leadership team, funding. The damn thing would never, ever scale, would never exit. And I thought, well, maybe I can buy myself or have someone pay for a 6-month immersion into the workings of healthcare, and that would make me a better angel investor. Well, I fell in love with the mission. I found that spectating a day in the life of a patient and a provider really began to reveal the litany of unmet needs that is U.S. healthcare. Candidly, for the first time, I was in a position to impact people and lives and communities, and that was a very powerful and humbling place to be. And so that's what I've been doing for the last 9 or so years. I started in a very nascent. It was definitely a de novo innovation platform. It evolved, it grew. We bolted on new functionalities, investment capabilities, product development, and a number of others. And it became it's become a robust platform for an organization of our size. And then that enabled me to transition into the strategy role that I'm in combination with the work that I've just made.
Super cool. I find that the coolest journeys aren't linear, in fashion. It's great that you mentioned the failed experience in being an angel investor, because I feel like that experience is so valuable, and knowing, like, you have the bumps and bruises of knowing what maybe you don't want to do, or how you want to try things differently.
No, that's exactly correct. And it's enabled me to give early stage companies and founders a different type of advice when it comes to the complexities of selling into healthcare. There isn't just a seller and a buyer. It's multifactorial. And if you're not prepared to pitch to all the constituents who are the combination of buyers and users and beneficiaries, you're just not going to gain traction. And so paying it forward from that perspective has been helpful to me. And I tell you, now I understand why I was a failed angel investor. I didn't appreciate the nuances of what it took to get a tool or a technology into workflows and embedded and paid for. Didn't understand things like reimbursements, etc. So, it's been a fascinating journey from that perspective.
Yeah, and consumed right on top of that, like once it's even rolled out successfully. And I just identify with that experience so much because I mean now we've, scaled up and work with many, many different health systems nationwide, but it was a learning curve and different organizations will come up to me and be like, how are you doing this? And above and beyond the relationships and thought leadership and hopefully a quality work product, you kind of nailed it. I feel like a lot of it has to do with being able to speak the language of a myriad of different personality types. And obviously it's not always just me, it's our team, but it's really being able to go wide, because the way health systems have grown and developed over time is, it's vast and different than any other industry that I've ever worked in for a myriad of different reasons. So it's complex. It's really
Yep.
just complex.
Really, and a lot of the complexity is own goals, David. It doesn't have to be that complex, but when you don't fix something, but you just patch something, process or platform, you end up with with complication that perhaps could have been avoided.
Yeah. I mean, along the course of your journey, I mean, you mentioned the experience as an angel investor, but is there a time that sticks out in your mind as, a pivotal time where you really took away a life lesson, either per a failing or something personally or professionally that happened, but it really kind of impacted your trajectory as an executive? Anything that sticks out in your mind?
I think for me, the notion that you never have to find yourself pigeonholed. You never have to find yourself constrained either by your or education or by your initial forays into the professional world. All knowledge is fungible. All experience is accretive, and the ability then to pivot industries, but use the learnings of prior experience. I think for me was perhaps I didn't appreciate that at the time, but I'll reflect back upon um, that reality. And, and I teach I stress to my students, don't feel that you're going to be in the lane line that you currently are. In 5 years' time, all of you are going to be doing something different. You may not believe that. You may not even want that, but circumstance, luck, opportunity, all these things, bad luck, these things are going to force you to have to think about how do I do something differently or somewhere else, or be impacted by the pace with which technology is going to impact traditional roles. So I think for me, looking back, the sort of, in retrospect, comfort of knowing that I wasn't trapped has been a takeaway from.
Yeah. And now I imagine though, I mean, because you hear about things like that, and as someone who went out as an entrepreneur and bootstrapped a company up to where we are right now, um, I had to there was fear there. I mean, I struggled with like fear of failure. I struggled with imposter syndrome early on. And I was flying over my skis all the while, still am to a certain extent. What I had to learn over time was getting comfortable being uncomfortable. Like I imagine when you pivoted to a totally different industry, or you mentioned like when you were out of that professional role for a bit, it was probably a bit uncomfortable, but it sounds like you really leaned into it. And I think that for me, feeling that fear, but then like really trying to lean into it and step through it is part of, what's kind of helped me on my journey.
And it's, as I'm sure you can appreciate, it's far easier to give that advice versus actually live it, because fear you can be atrophied by fear. And there've absolutely been times where fear has held me back. It's sort of created a different type of risk tolerance for me that at times probably hasn't been helpful. I came out of relatively humble, a humble background overseas, and my wife would consistently say to me, "Why are you always looking over your shoulder at poverty? You're fine." And of course, I could intellectualize that, but at a cellular level, I couldn't really liberate myself, if you will. So um, it takes time.
Yeah.
The generation that is now at the early stages of their career or coming out of college, they're far more equipped to move positions and make more rapid change decisions and career pivots. I grew up in an era where candidly, you didn't really do that. And in fact, if your resume featured too many stops in the first X years, it was clearly a red flag. Something's wrong here. Whereas now, if I get a resume from someone who's 29 and they haven't had 4 roles, I'm wondering what's wrong here. It's almost flipped.
Yeah. No, you're absolutely right. And we've even seen in the recent years too, like, thankfully, folks coming from like the retail industry into healthcare, or, and we try to do that with the disruptive innovators, where we get people who have had different, right? Because we talked about healthcare as it stands being somewhat complex and unique, but not terminally unique, right? Not such that some of these organizations that have gone through massive digital transformation can't serve in a very, innovative capacity.
The myopia in healthcare is debilitating. And I'm proud of the fact that our innovation team is made up of people primarily not from healthcare, people with digital backgrounds, people with manufacturing backgrounds or hospitality backgrounds, um, to really enable them to ask the "why do you do it that way" questions, and how might we think about doing it differently. Um, and it's been helpful, and it's manifested in some of the opportunities that we've been able to deliver to the system. But to an earlier point that you made, the only promise I make when I'm recruiting for the team is there will be ambiguity, and you better be comfortable with that. And you also better be an "and" person, which means you have a primary designation and you can flex into something else, because we truly are flat and very matrixed, antithetical in healthcare, which is very hierarchical and title driven.
Yeah. Funny. I've all but eliminated "but" from my vocabulary. I almost don't use it anymore. I find I only use it if I'm intentionally discounting what I previously said. Yeah, very cool. So I actually want to get into a little bit more about what you're doing at the university hospitals and with the innovation team. Before we do, I always just like to ask uh, how I build my reading list. Favorite book or literary piece, either that you've been reading currently or all time, your choice.
Yeah, I mean, all time, I look back on something like Sapiens, Harari's Sapiens. Currently, though, I'm reading a book by Robert and James Rebitzer, brothers who are educators and academics, and they wrote a book related to healthcare and innovation. Why not better and cheap? And this notion of the sins of the fathers have created this threshold of complexity that is debilitating. And whether it's the manner in which we get paid, the manner in which our customers think about value, whether it's the notion of innovation being really at a point of care versus systemic, all of those types of elements. And couldn't have come at a better time from the perspective of this need to disrupt ourselves right now. So that's currently what I'm reading.
Yeah, I got to look into that. And I struggle sometimes to think about, how to unwind some of the more institutionalized, like, constructs of the healthcare industry, like how insurance pays hospitals, the discounts off of overinflated procedural prices, like, just like, where do you start in, like, who takes the first step, because it's all intertwined. It's tricky, but
I'd like to say the $1 billion balance sheet and bottom line should come a little bit closer to us, David, because we don't have a bottom line at the moment, and so there's a lot of mythology when it comes to who, in quotes, is getting rich here. And of course, businesses are businesses, and are entitled to have profits and bottom lines, but the disparity is glaring at this point. There is some reimagination to have to be had when it comes to our relationships with payers and insurance, and we're working on some perhaps novel models around that.
yeah, looking forward to that. But let's talk about, so you've been at university hospitals now for a little while. You have kind of this role as a strategy innovation officer of the health system, and you have your innovation portfolio that you're overseeing. Talk to me just a little bit about your vision, maybe some of the key initiatives you're working on that you are able to share about, anything like that.
And I don't think any of these are going to be revelationary or novel, because I think many systems our size are looking to do similar. But we're actually looking to optimize through very targeted and focused reduction. We have millions of square foot of space. The ROA on a lot of that is unenviable. How might we rationalize some of that from the perspective of creating volume centers and creating some one-stop shopping for our patients, and utilizing the economies to be had if we were in fact to begin to rationalize some of our bloated real estate footprint, as an example. The same could be said for certain service lines. Not get out of the service line, but how do we position the service line to be more optimal from the perspective of patient access, be more available to patients, and to be adjacent to the support mechanisms versus separate and distinct. And then this notion of technology embrace. Certainly, I'm not naive enough to say technology is going to save us. But technology is certainly going to change the day in the life of the patient and the provider. How might we use AI to eliminate some of the administrative burden? How can we use AI again, because it is topic du jour, I suppose, to think about predicting and preempting and guiding our decisioning, clinical and administrative, in order to be more efficient? I could go on, but those are some of the elements that we are grappling. We start with this notion of what are the highest value problems. We detest solutions. We're a human-centered design shop, so we always focus on unpacking and rebuilding the problem statement to make sure it can be shocked and sustained. And then that enables us to then consider how do we solicit potential solutions against a tight problem statement.
Love that. And our customer event that just passed was all surrounding how these technology solutions are supporting the human experience, right? Like it's a tool, right, that we can leverage. And I think you touched on before, and I think it's great that you're a professor, because you clearly have some great experience to offer. But the fact that like the workforce now and forever will be changed, in regard to the impact or what will be necessary by way of upskilling, and in certain roles how they'll change and evolve, and then just in general the jobs that will be made available to like my children who are 1.5 and 3.5. It's wild to think about.
They will be trained. Their education will be infused with the marriage of tool and person. Whereas my son, who's in his early 30s and a physician in Atlanta, was at the cusp of his training, not including the adoption of technologies other than clinical technologies. And so, he puts himself in a position where he plays a little bit of catch up, but he's also able to spectate to perceive the reality of his job is going to change materially starting now. Um, so, it's a fascinating time. My fear, David, is we lose empathy. Uh, we don't continue to train for empathy, um, or our data sets that train models. We can, bias is a topic in and of itself. Might not at this stage have a threshold of empathy, interwoven into the output. So fascinating problems to solve for.
They are, and fascinating to test, right? Because I've had a number of conversations with Dr. Stephanie Lair, for example, who was at Monument Health for a while. Now she's working on some stuff with a company called Artisite, and she points to some studies where AI was actually proven to be more compassionate than some of the folks that were on the line, right? And I don't think it's either or, right? But it's interesting because depending on how I think uh, what the culture is within the organization that we're talking about, right? Because every health system is different, what they've gone through, what their employees have gone through during COVID, all of it. It's just some of them are very tired and rightfully so. And they haven't been given the tools they need to really be there and connect with the patient. And when we talk about when at the conference, when we're talking about like the the human experience, right? Like if I can free up someone in that access center to not have to look up the patient, to not have to transcribe what's going on, to recommend next best action, like I can really be here with David because I'm not having to focus about any of it. And that's big.
Yeah, we're piloting an adjacency to Epic right now, which is a digital scribe. And the value prop here is, um, you and I are so comfortable being in the physician's office while you see the ear on the side of their face because they're typing away and they're not actually able to look at you and look at me. How can we actually take the keyboard out of the encounter, have the interaction be face to face, and at the end of that encounter, have all of the notes prepared, the prescriptions filed, the data dropped into patient records, and parallel and simultaneous to that, an 8th to 10th grade version of the encounter generated so that the patient can leave or the patient's family can leave with something that they're actually able to digest. You and I can look at go to our my chart, incomprehensible, and it's not helpful because that can induce more anxiety than is necessary. So now we've given time back to people. We've created time, and I think created time and perhaps accuracy. So there's a risk avoidance component to this as well, but that will put the person back into the encounter, put the humanity back into the encounter versus it being, more focused on the administration thereof.
Love that. Yeah, that's a great example. I mean, and we talked about some of the challenges facing the healthcare industry just in general, but what are some of the biggest challenges that you're facing in your role, either on the, hospital side or on the inpatient side?
Well, more on the hospital side, and I don't think we're alone. Depending on your payer mix, depending on the age of your patient demographics, depending on whether or not you're in a population growth or decline geography. Those factors can really whittle away at what's candidly a very meager bottom line in the first place. You're now seeing rural and community hospitals closing as a result of that. And maybe great for the big hospital competitor who's 7 miles down the road, 70 miles down the road, dreadful and disastrous for the communities that no longer have access to care. So this internal an external continued struggle with regard to what is cost of goods and how might you be reimbursed at a threshold that at least covers that, I think is one of the major challenges that we're facing. There's always legislative risk in terms of what might be a topic du jour for someone to want to take a run at healthcare around, whether that's 340B, for example, specialty pharmacy as an example. And then I think so we've got the business risk, we've got the legislative risk, the resiliency risk, the burnout rate is debilitating, and it's actually dissuading students from going into healthcare. And there's certain specialties and certain general primary care. We can no longer hire at a pace that will enable us to adequately serve our patients. And, unless we change the way in which the day in the life of, as I mentioned earlier, the burnout will continue, and the knock-on effect of discouraging and dissuading other people to take their place could initiate an existential crisis for us.
Yeah, I mean, it's the national issue. I mean, I was at a CEO roundtable not so long ago, and if you look at like McKinsey is running the numbers of like the number of physicians in that like baby boomer, range who are retiring, and the number of students who are looking into healthcare, and it's scary, like the shortfall.
Something like
So
250,000 physicians short by 2030. I mean, I might have got that wrong, or the
no,
magnitude
it's something like that.
difference,
You're
something like
absolutely
that.
right.
Well,
So yeah, scary stuff. But I think you're right. It has to do with well, I think it's multifaceted. I think it's like, okay, how do we do more with less, or how do we better enable the folks that are, being with patients to be there with patients and do their jobs more efficiently. And at the same time, how are we evolving as an industry to make healthcare more attractive again to prospective students? And that actually kind of dovetails into, one of my last questions for you. I have a few here. One would be, where do you see the healthcare industry going in the future, with the understanding you don't have a crystal ball, but like, if you had the magic wand, what do you think will be, or what would you have be some of the biggest changes as time passes, and maybe some of the biggest opportunities?
well, certainly we're seeing a appropriate migration to the outpatient setting. The extrapolation of that is, how might we then ensure that healthy at home, healing at home actually gains the appropriate foothold? Challenge there, of course, is how are you tethered then back to your care provider in terms of your wellness? And it used to be, well, you have 3 wearables. Well, no one wants to do that. Now it's a case of, how can we use environmental genetics? How can your home actually be part of your caregiver continuum? Measuring behaviors and weight and temperature and heart rate variability and a whole host of other things. And we and many others are working on that with the use of AI, and in partnership with non-healthcare industries who've already perfected tools and technologies that we might be able to adapt to this use case. So for me, digital access and a healing environment that acts as your tether back to your care providers, keeping people out of the hospital and creating more of a ambient, passive, retail-like experience for patients. That's where I believe we're going. That's where I hope.
Yeah, I love that. Yeah, I love to see health systems like university hospitals like making those strides. And I'm working with Guthrie Clinic, and they have like an access center, but like they're doing they're looking at the full continuum of care, which I think is so important, right? David, this has been amazing. I mean, really insightful. My final question I like to ask all my guests is just if you could go back 5, 10, 15 years in time, what advice would you give your younger self?
Great question. I probably would have said to myself, you're stuck, make a change. Stayed in an industry far longer than I should have from a fulfillment, mental health, and an enjoyment perspective, because I was a little bit trapped by compensation. And I didn't feel that I knew how to reinvent myself. If I could have gone back, if I could go back there now, I would have got unstuck quicker, untrapped quicker. Um, so maybe said differently, this notion of take a bit of a risk, step out of the comfort zone, understand that you'll figure it out. If you've figured it out before, you'll figure it out again. And really, really don't allow your mental or physical health to deteriorate to a point where the decision is sort of made for you. That's what I would have said.
I love that. And I mean, it just makes me think too about how many people helped me get to where I am, right? So I really relied on a business coach, colleagues, a therapist, like all these different individuals who helped me get through those times. So I guess what I would add to that to anybody who's listening is just like, if you are feeling stuck, like you don't have to go it alone, right? Like reach out to people because people have had that experience, right? So it's a great way to end the episode, David. I appreciate you so much being on. Thank you so much.
Well, I really enjoyed the chat, and I appreciate you, and I look forward to staying connected.
Yeah, absolutely. And to our listeners, thank you for tuning in. We will catch you all next week.